May-June time frame of 2006, my wife became pregnant. We met the gynecologist, and as part of the routine test, the gynecologist suggested that you have to go through the series of tests, and we did the tests and came out with the reports. And one of the report was actually showing that the platelet count was lesser than the normal range, and typically it has to be above 150,000. So it was actually roughly around 70,000. So she actually suggested that you go to another lab and do the test again and come back. We did the test again and it was around 73,000. So there's not significant difference, but significantly lower than the range. And so what she did was she said that while there's a great news that she is pregnant, which was fantastic, but then it seems that there is a problem related to the platelets. For that, you need to consult a hematologist. So I took my wife to one of the best and renowned hematologists in Bangalore, and the hematologist asked us to do a number of tests. We did series of tests, and the report actually suggested that she is actually a chronic ITP patient. And I started consulting in 2007 all the doctors, the best hematologists in India. I started consulting the best hematologists across the globe. And frankly, I spent a lot of time and energy in doing a lot of research, and I found, after talking to doctors in India and outside India, that there is no disease, there is no treatment to this disease. While there were a number of treatments you have to go through, but there is no guarantee. The probability of the success rate was between 30 to 70%, and each treatment was costing huge money. So, and she went through a lot of treatments, right from taking the medicines, very costly medicines, to actually splectotomy, which was supposed to sort of resolve the problem, but there was no solution. And I found a noble doctor called Dr. Vidayasagaran actually doing research on chronic ITP for many years, more than a decade. And I was like very excited, and that was like ray of hope in me, that yes, I want to meet this doctor and see if he can actually help us in curing this disease. So I took the contact details, spoke to Dr. Vidayasagaran. He said that, hey, come here. His clinic was very near to Calicut, which is in Kerala. We went to see him in 2011. We went to see him, and he heard our story, and he actually committed to me and to my wife that he is going to cure this disease in 3 years. The only condition was that we had to stick to his treatment. That's it, nothing else. And we have to make sure that we do take the reports or do the test on a regular basis and share the reports with him. And more importantly, the medicines that was actually that he suggested were actually handmade. He was making those medicines, and he will give medicines only for 3 months, and every 3 months we had to come from Bangalore to go to Calicut and then come back, so to take those medicines. And also he said that he wants to actually see the overall see the patient, which is my wife. Her name is Monica, and after that and as I said, 3 years commitment. We continued to take the medicines. Medicines were easy to take, handmade medicine, as I said. There's no side effect, because from 2006 to 2011, she took a lot of medicines, and we saw the pain and agony she was going through. The blood pressure, blood sugar will go up. She will lose the conscience, she will have no control over the body for a reasonable period of time. It was real pain, and she had to actually manage the kid as well. She was growing, so it was really painful. But giving this assurance and reassurance by Dr. Vidayasagaran was fantastic. Within 2 years, we saw within 6 to 1 year, we saw a lot of improvement in her platelet count. It was stable. As I said, it was 30,000, but after taking medicine, it went to 70,000, 80,000, and touched 100,000 plus. And after 2 years, doctor actually said, stop the medicines, and you don't need to take medicine. She's perfectly all right. We actually monitored the count from 2013 when we stopped the medicine till 2015, and it was absolutely okay. Touch wood, she is doing well. Dr. Vidayasagaran actually came as a god in our life. And I always say, to our relatives, to my friends who knew my wife is going through this pain and agony, that he actually came as an avatar of God. So he really came as an avatar. What I really like about Dr. Vidyasagar is his passion, his genuine interest in basically treating the disease, this chronic ITP disease, because clearly in clinical medicine there is no treatment to this disease. The patient has to go through pain and agony, lot of different treatments, in other words experimentation, but no real commitment or guarantee that this disease will be cured. Dr. Vidyasagar actually, with his so much of with his passion and genuine interest, and have done so much of research on this disease, is the only doctor I have heard and seen, and actually we have seen, he has demonstrated the results as well. In our case, for my wife, while he has actually cured the disease, tremendous passion, his genuinity in towards humanity in curing the disease, no real commercialization. He doesn't want to really make money out of this. He wants to really serve the community, and that is coming out very, very clearly. The second thing which really liked about him was his his knowledge about medicines. He came across as a doctor who actually knows about allopathic medicines, about Ayurvedic medicines, about homeopathic medicines extremely well, extremely well. Fantastic. And third was fantastic human being, approachable, can relate with the disease, can relate with has empathy towards the patient. He listens to the patient. He doesn't ridicule anything. He doesn't come across arrogant, and which I have seen typically in the clinical medicines when you interact with doctors who are of repute or of fame. Fantastic doctor, fantastic. So I would say, if I had to summarize, he's a great doctor, fantastic doctor. He's a great human being. He has a genuine interest in actually treating the disease of chronic ITP. I would humbly request all of the biggies in the pharmaceutical industry to please work with Dr. Vidyasagar to bring this to life, to larger sort of community, or society, or to nation, or to globe, because there are patients suffering through this ITP for many years, and there is no real treatment. It's real pain, because I have personally seen it, monitoring my wife's, stats over a period of from 2016 to 2013. So I think I would personally, again, request all of, the pharmaceutical heads, who run the organizations, to partner with doctor and help him to bring this to wider set of people across or masses across the globe. If Dr. Vidyasagar is watching this video, I want to personally thank him. I have actually thanked him over the phone, but I want to again personally thank him. He has come across as a god. I wish him all the success in his mission. He has a genuine mission, mission and a vision in taking to the masses this medicine, so that he can treat the patients. And I want him to have many hospitals, not only in Kerala, not only in India, but globally as well. Best of luck, and we are all with you, doctor. Thank you very much.